you are the kind of person in America totally self-insured, no, you're working without a net, is what it really amounts to. If you fall off the high wire, you hit nothing but the ground. And there are a lot of people like you. And you know, there's sometimes, I think, a mistake to think that people are uninsured because they're unemployed. A lot of people are uninsured because they are employed, but they're just like this gentleman who's self-employed. And one of the reasons that we have the health care insurance mess we have is because we're still basing our health insurance system off a post-World War II model when people went to work for a big company, and because the tax laws favored big companies giving insurance as a benefit, as a tax write-off to the company, people went to work, they stayed, they worked the same place for 40 years, they retired, and their health system followed them in their jobs. People change jobs every 7 years now, not every 40. Very few people, what job they started when they're 21 years old, will still be working there when they're 30. They're going to be working something else. So the health care they have is not portable. It has to be. That's why we need to go from a system where it's not tied to your employer, whether it's self-employment or working for the paper mill, that it's tied to you. And the second thing is that the risks are shared across. That's how you lower the cost, when the risks are not solely on him. Because if you have one major catastrophic issue, then you could be bankrupt. And if you buy a policy and you use it for something major, then you could become uninsurable, or they could raise your rates to the point you couldn't afford it. And all of those factors make it almost impossible for the average person to be able to get there. So the interim process, before there is a sense in which there is real sort of universal coverage, is making sure that there's total deductibility of those expenses and that there's a safety net. We did a program in Arkansas called Our Health Net. It was for small businesses who couldn't afford insurance for their small businesses. Sometimes it was 2 or 3 people. And it gave them a partnership, so at least there was a safety net under those folks. And you know what we forget? 80% of all jobs in this country come from small business. And yet most of the insurance laws, as far as to enable a business, they don't help small business, they help large business. And one of the reasons a lot of criticism is directed toward me as a candidate is because I know I'm not the favorite of Wall Street or Washington, but I think I have a better understanding of what's happening on Main Street with small business people, because the tax system and the insurance system makes it incredibly difficult for you to survive. You're basically operating with a health savings account for all practical purposes without the insurance that backs up that first part of it. Wouldn't that be about right? You don't have any policy, you don't have a catastrophic policy at all. And so the ideal situation is that there would be a certain amount of money that you could afford, but then after that, if your health care hit beyond it, there would be a catastrophic policy that would be, you know, underneath you. But if you're individual, the cost of buying it individually is probably unaffordable, because buying it individually means there's no shared risk with anybody but you. Putting Yeah, you can't afford that. So that's why I'm saying you have to be put where everybody who's in your shape could be put in the same group. And when that happens and the risk is shared over several million people over than just shared with you, guess what happens? You could afford the cost. And part of it, I don't know why that's so difficult sometimes for Washington to figure out. Create that kind of pool where every individual who's self-employed, small businesses, could have that kind of access into a larger pool where the risks then are shared. The insurance companies would have a better marketplace. Government would have less to guarantee in terms of if people fell through the cracks completely. And the best thing of all, you'd actually get covered.
I'm not looking for freebies, you know.
Yeah.
I just want something I can afford. And I'll tell you, find me the candidate that will go, you know, that'll help us out and do something like that, and that's the person I vote for.
Thank you. I'll look for your vote on January the 8th, because I think we can get there.